On behalf of Shankara Eye Hospital, Guntur, we would like to share few tips and tricks in handling unusual scenarios on table. Any ophthalmic surgery has the potential to surprise the surgeon by sudden aggravation of systemic comorbidity. This may occur in spite of taking all proactive precautionary measures. Management of patients with head nodding, cervical spondylitis, asthma, kyphoscoliosis, and apprehension is a challenge to the surgeon. These comorbidities place a geriatric patient at a higher risk for surgical complications. The acquisition of skills to handle such situations is necessary so that the surgeon is ready to handle any difficult situation on the table when the need arises. We often come across patients with Parkinsonism who have head nodding. It is important to have a stable head and eye to prevent intraoperative complications. Here, to stabilize the head, we place rolled sheets below the neck, and also sheets are placed on either side of the head to prevent the head movement. Intraoperatively, slight hyperextension of the neck is usually necessary for good coaxial view. But in patients with cervical spondylitis, this maneuver is not possible. So, we place a rolled sheet under the neck to support both neck as well as head. Preoperative evaluation and counseling play an important role. Asthmatic patients are advised to bring their inhaler along on the day of surgery. A surgical drape usually causes anxiety, which can precipitate an asthma attack. To avoid this, a drape test is performed preoperatively to get the patient accustomed to the procedure. And the patient is also advised to take 2 puffs of the inhaler before the start of surgery. During the procedure, oxygen is supplied by nasal prongs. The drape at the distal end is kept open for adequate ventilation. An operation theatre environment may be stressful and can induce anxiety and panic attack. So all the patients should be explained about the procedure. An anxiolytic can be given preoperatively. To prevent claustrophobia, the drape can be kept open distally for adequate ventilation. A small talk before and during the surgery helps the patient stay calm during the procedure. On-table positioning of a patient with kyphoscoliosis is always a challenge, as it is not possible for the patient to lie supine. Here, the head and neck of the patient are supported by pillows and sheets, whereas the surgeon must perform the surgery by standing to compensate for the high level of patient's head. Hope these maneuvers help you perform a better surgery. Thank you.